What are those? Those are mosquitoes. Who are you? A 12-year-old Nigerian boy. Why does this matter? Because it's hard for you to breathe and everything hurts. Why can't you breathe? I'll explain it later. Stop asking questions and stop thinking. Welcome to Sub-Saharan Africa. This is IMS and Hemoglobin by Justin Fan. Let's do the science. The average adult at rest consumes 250 milliliters of pure oxygen per minute. That's a lot of oxygen. So we use a protein in your red blood cells to efficiently transport that oxygen called hemoglobin.
Hi, this is Sir Meech. The O is silence. It is also pronounced hemoglobin for British people.
Hemoglobin has 4 subunits, 2 alphas and 2 betas. There's no real difference between them besides shape. Alpha chains have fewer helix structures and some other structural differences. These subunits are cooperative, meaning they have an increasing oxygen affinity as they gain more oxygen. Each subunit has one heme group, which has 1 iron atom, 4 nitrogen atoms. These atoms use electron lone pairs and opposite charges to attract an oxygen molecule. Before we go further, let's talk about structure. When not bound to oxygen, the iron atom is pulled out of the plane of the peripherin, a chemical that helps make hemoglobin, towards the histidine residue, which is a molecule that helps create the structure. The valence electrons in the atom surrounding the iron in the heme group and the valence electrons in the histidine residue form clouds of electrons, resulting in electrons repelling each other in the formation of a dome shape. While originally nonpolar, iron's 2+ charge attracts oxygen's 2- charge. They become polar after they bond with the oxygen, creating an ion-induced dipole-dipole IMF, causing the structure to change. We also see hydrogen bonding form from the hydrogen-nitrogen bonds in the heme molecule, allowing it to keep its structure while making it harder to denature. Another structure we have to slightly worry about is protein, such as the subunits that comprise hemoglobin. Proteins have 4 levels: primary, secondary, tertiary, and quaternary. In the primary structure, proteins are composed of an amino group, a carboxyl group, and a side R group. The differences in the side group result in proteins with different properties: polar and nonpolar, shape, and size. The secondary structure of the proteins contain alpha helixes and beta sheets. These are important because these structures are formed from intermolecular hydrogen bonds between amide groups in separate chains. The tertiary and quaternary structures focus on the overall 3D shape of the protein. Back to Sub-Saharan Africa. Mosquitoes are a major issue in poor developing countries, leading to lots of deaths from mosquito-borne viruses, primarily malaria, a type of parasite infection that harms red blood cells and causes anemia. To counter this, the human body mutated its DNA for red blood cells. This genetic disease is called sickle cell disease, named after the shape of its mutated RBCs. Normal red blood cells are disc-shaped, making them flexible and fluidly. Sickle cells, however, clump to form a sickle or crescent shape after they give their oxygen. Due to their unusual shape, they clump together. This is caused by switching in the side groups of the heme proteins. The valine causes the protein structure to change, which causes it to form long chains instead of tetrameres. Valine makes a part of the protein nonpolar, which makes it want to bind and form long chains. Symptom-wise, sickle cells clump together more often and result in blood clots, anemia, reduced oxygen flow, and constant pain. While sickle cell patients don't have better resistance to the parasite, the toxic environment in the filtration system and overdrug make the body a toxic place for the malaria plasmodium parasite. This is why over 80% of all sickle cell patients live in sub-Saharan Africa. However, most of these patients are heterozygous, meaning they have both regular and mutated cells. This is by no means to say that the disease is good. It causes difficulty breathing, shorter-lived blood cells, damages to the spleen and other filtration organs, and result in a shorter lifespan.